So every day a new problem arises. It takes a lot of time for us to understand here. So in these 3 or 4 months, we have learned a lot about this and we are trying to control the disease. We are trying to develop a vaccine and all. But till that, no, we have to control the severity of the disease, control the spread of the disease, and prevent death due to this disease. Now, when I said spread of the disease, we have already seen the mode of spread. It spreads through the droplets. But just a small introduction before we start. If you see the history of the disease, you have an incubation period, the interval between the entry of the organism and the appearance of the symptoms. For COVID-19, it is around 5 to 14 days that we have discussed already in my previous. Then after the incubation period, you have the period of illness. This period of illness is very important because only during this period the person suffers from the symptoms and signs of that particular disease. So the person experiences certain disturbances and we call it as symptom. We have three phases of this disease. One is the incubatory period, and second is the clinical period, third is the convalescent period. During the incubation period, the organism multiplies and the patient may not know that he has a organism inside. So the next period, clinical period. During this clinical period only, the patient experiences the symptoms. The third phase, the convalescent period, is a period after treatment, after recovery, complete recovery. Recovery means the patient does not suffer here. That means he has no symptoms. So in these three phases, the first incubatory period, which is about 5 to 14 days in this disease, they don't suffer from any symptoms, but the organism is inside. The last period, convalescent, they don't suffer from symptoms because they have recovered from the disease. So that means only during the clinical period they have symptoms. In fact, only because of the symptoms they go to a hospital or a doctor to check or to test whether they have the problem or not. So symptoms play a very crucial role for a person to go to a doctor or go to a hospital. So what we are talking now is about people who have the disease but they do not have the symptoms. That means they don't have suffering. In that case, what happens? Incubatory period also no symptoms. During the clinical period also no symptoms, and convalescent period also no symptoms. So what is there in it? The patient may not know that he is having the disease. Remember, I tell you, he is not suffering from the disease because if he is suffering, he will go to a hospital. He is only having the disease without any sufferings. That suffering, you call it symptoms. Maybe some people who have the organism inside without having symptoms. We call these people as asymptomatic people. Spectrum of disease. The disease manifests in various forms. You call it spectrum of disease. One is asymptomatic. Right now what we are going to talk, or it is called unrecognized disease. Some people may have a mild disease and some people moderate and some people critical and death. Mild disease person may not know. Asymptomatic the person may not know. Moderate disease in between critical and mild, so the person may have a doubt, so the possibility of checking is there for that person. So we are not worried about these people, we are worried about mild. Even then we are much worried about asymptomatic or unrecognized people who are really having the problem inside but they don't suffer from the problem, they don't have any symptoms. You call it asymptomatic. What is a symptom? Symptom is nothing but the subjective experience, what the person experiences, that is the symptoms. In fact, it is a complaint. The person complains what all he experiences. All these you call it symptoms. So what is the significance of this symptom? I told you during incubation period in which the organism is multiplying inside, they don't have any symptoms. The organism has multiplied to a particular level Now the immune system starts recognizing this and starts producing antibodies against this antigen, which is a virus. Now what happens? There is a fight between the immune system and the organism. So during this, the body gives responses to these responses, during which the immune system is fighting against the virus. The person suffers from what is called all these symptoms. So in a way, symptom means the body is fighting against an enemy, here the virus. So if you don't have any symptom, then you may not know that the body is fighting, and you may not know the organism is there, so you may not go for a checkup. So in that case, the organism comes and goes because the immune system destroys the organism during the fight before they produce a clinical disease or a disease with all the signs and symptoms of that particular disease. Now, what are the symptoms here in coronavirus? You have fever, tiredness, dry cough, breathlessness, muscle pain, chills, cold, headache, sore throat, loss of smell and taste, and sometimes a little bit of diarrhea or vomiting. It is not necessary that the person should have all these symptoms. There are many important specific symptoms for this disease. Most of the symptoms are very common to flu like diseases or even common cold, but fever is one important symptom. So, when a person experiences one of the important symptoms of this problem or a combination of these symptoms, then the person may go for a test to confirm whether he is having this problem. As I told you, the organism multiplies during the incubation period. The immune system starts fighting against it by producing antibodies. This During this fight, the person experiences the symptoms. So that means what? If the organism is multiplying more and more and more, and if the immune system is not able to destroy or neutralize the organism before it reaches a particular level, then the person experiences the symptoms. If the immune system is strong, if the response of the immune system is very strong, it produces more of antibodies. Naturally, it prevents the replication or multiplication of the virus. When the virus is not able to reach a particular number, it cannot produce the symptoms in the body. So before the symptoms, the body destroys. In fact, because the body destroys the organism, you don't suffer from a disease. So in the fight between the virus and the immune system wins the fight and the virus fails, and you will not have the symptoms. But remember, the virus enters, tries to multiply, tries to produce these symptoms and signs of that particular disease, but because of the strength of the immune system, we recover without any symptoms. If the immune system is very weak, the person's immune system fails and the virus wins the game or the fight, and it produces a clinical symptom in which you have the classical symptoms and signs, as I told you, the cough, the breathlessness, the fever, etc. So what is this asymptomatic, and why this problem? Why we are giving importance to this asymptomatic people? Remember, asymptom means absence of symptom, presence of the organism in his body. Only thing is, the immune system has prevented the multiplication of the organism, but the number of organisms will be there, especially during this clinical period. The person will be having or harboring the organism in his body, and organism is present, symptoms are absent. That means he becomes a source of infection. Indirectly, it means a silent transmission. Without knowing, without suffering, the person will give the organism to the society or to the community. So he becomes a threat for the community. In fact, he is one of the source for the community spread, in which we are going for the third stage. You call it community spread. We all know community spread means we don't know the source of infection. In the second stage, you know the source of infection. You can trace the contact and you can treat all. But once the community spread starts, then it is very difficult to find the source. So automatically it is very, very difficult to control the disease, control the spread of the disease. So it becomes a failure after all these lockdown days. So these asymptomatic people will never get sick. That means they will never suffer from the symptoms of the disease. No cough, no fever, etc. But there is another person called pre-symptomatic people. Pre-symptomatic means they are in the incubation period. Incubation period means, as I told you, entry of the organism, multiplication of organism, appearance of the first symptom. So that means these people will have symptom at the end of incubation period. So they are not asymptomatic people, but they are called pre-symptomatic, before the symptoms. That is, they are also threat to the society, because during this incubation period, during this pre-symptomatic period also, they will not have any symptoms. So they also become a silent transmitting people. Who are all these people? Who become asymptomatic, and what makes them asymptomatic? What decides whether they will suffer from the disease or they will win the disease? One is young people who have a very good, strong immune system. And even if it is not young people, people who have a strong immune system, that means they are healthy people without any other diseases, comorbidities we call, whether they have another other diseases like diabetes, which already will suppress the immune system, and there are some medicines which they may be taking for a long time due to some other reasons, due to some other disease, to suppress the immune system they may be taking some drugs. So these medicines and drugs may weaken the immune system. And the next reason why they may not show severity of the symptoms, they depend on the viral load. Then less number of virus will also cause less symptoms or symptomless. So they become asymptomatic. During the incubation period, they don't have symptoms, they can't spread. So they are also asymptomatic, but we call it pre-symptomatic because they are going to get it. Next, during the period of illness, more number of antibodies produced by the immune system. So this number of antibodies prevent the replication of the viruses. So the number of virus is less. But even though the number of virus is less, they can transmit the disease. Because the number of viruses is less, immunity is more. They will not suffer from the symptoms. So I call this as a asymptomatic people during the period of illness. The next period also, during the convalescent period, here also number of organism is less, number of antibodies is more. So here also there won't be any symptoms. But one thing is, convalescent, when I say they had a problem, they have suffered, they had a full clinical disease, they had treatment and they have recovered. So recovered people, we call it convalescent period. But asymptomatic means even during convalescence, they will not have symptoms because they have already covered and they have developed antibodies. So subclinical disease. What is this subclinical disease? I told you, entry of the organism, incubation period, multiplication of the organism, a clinical disease. A clinical disease means he will have all the symptoms and signs of the disease. He will suffer for a particular period of time and he will recover. So this is a classical disease. That means he will suffer all the signs and symptoms of the disease. The next scenario I told, the organism enters, they are not able to multiply much, and the immune system works very hard, and immune system prevents the multiplication or replication. So without any symptoms, with less number of organisms and more number of antibodies, they recover from the disease. Only thing is they don't know that they had the infection and they recovered, and we call it as a subclinical disease. So these subclinical disease, these people, they will carry this organism during this incubation period. during the illness period without these symptoms, and during the convalescent period, all this period they will have this organism and they will transmit to others. We know that it is spread by droplet infection, by coughing or by sneezing, and a person who is not having the protective equipments like a mask, he will spread. Now the question is, the person will not be having a cough or sneezing or anything for that matter, that symptoms. Then how asymptomatic people spread the disease? They'll be speaking, laughing, sometimes occasional sneezing, not because of the disease, but due to some other allergy, something like that. Then during all those things, people may cover their mouth when they sneeze. Naturally, then they'll wipe the hand on some surfaces. So that is the source of infection for this. They may touch objects, handling of things. A very good example is vendor. He may have this asymptomatic disease, and these people are the source of infection because even though they don't cough or sneeze, they spread even during speaking and laughing, during which the organism may come out as a droplet. The problem is the person thinks he's not sick, so he may not use personal protective equipments like mask. So now, without his knowledge, without knowing that he is a potential source of infection, he will be spreading the infection to the public. Now you know the importance of asymptomatic carriers or asymptomatic people. So how to know? Only by testing. But remember, we test only the suspects or doubts or contacts. But here, he will not give any history. He will not show a contact because he would have got the problem from another asymptomatic person. So that person is also asymptomatic. This person get the problem. He becomes an asymptomatic patient. So the only thing is random checking with people. So there is no other go except for testing. So this is where we need a testing tool like a rapid testing, which is nothing but the screening test. Even without suspicion, without a doubt, very randomly we will do this rapid test to know the presence of already infected people in a community, in a place, in a village, wherever we. So the only solution is testing, testing, and testing. Now comes how to deal with these people, how to prevent the spread from asymptomatic. Here comes your personal protective equipments, or what are the things we are doing? We are advising a mask, we are advising hand washing, we are advising social distancing. The mask, lot of doubt. People ask whether I should wear mask. The opinion about mask was different about 1 month back. Now the opinion is entirely different. Previously we asked this mask for people only who are suffering this problem, and healthcare workers, doctors and nurses, etc. Now remember, the patient may not know that he is suffering. So without his knowledge, he may spread. Don't you think that a mask will now prevent this? So this mask actually, when you ask everybody to wear this mask, you are preventing the spread of the disease from an asymptomatic person. Now the question whether to wear or not disappears. Yes, you have to wear. It is a must. Even if you don't show any symptoms. Because if you are asymptomatic person, if you are having the organism, when you cough or when you sneeze or when you speak or when you laugh, the organism will be prevented from going out of, and you put a barrier for the escape of the organism by a mask. When you go out, you touch objects, then you come to your house. If you follow the hand washing, or there also you prevent. And when you go out for for some essential purposes, if you keep distancing, you will not touch many objects. And even if he is an asymptomatic person who is not wearing a mask, you will not get the problem. Now you know the importance of masks, of hand washing, social distancing. Remember these three pillars, If you don't do any one of this, then you are going to get this problem and you are going to spread this problem to others. Mask, hand washing, social distancing definitely prevent you from not only the people who are suffering from this disease, but also asymptomatic people who are the potential threat to the society, who are carrying the organism without any symptoms, and who are going to give this to the society, and they are the causes for what is called stage 3, that is community spread. So remember this. Why we are insisting like this? If we follow all these measures, definitely we can prevent the spread, we can control the disease. In the meantime, to develop a vaccine or to find out some new drugs to treat these people. So, till that time comes, is it not our duty to prevent the spread, to control the spread, so that we help people who are trying to develop vaccine? So, at this junction, I am reminded of these words Churchill. This is not the end, not even the beginning of the end, because we don't know, it has just begun. It is going on. In fact, it may be the end of the beginning. That means it has already begun. It is going on. We don't know the end. At least we will try put a comma, if not a full stop, to this disease. Thank you.